I'm Lisa Buckley. I'm with the Training and Education Core of the Injury Centre. Thank you everybody for coming, and please help yourself. I'm going to make a special mention. Help yourself to the sandwiches, salad, sweets, if you haven't yet. We also like to welcome some people joining us remotely, if you've logged on to the event, that's great. And remember there's a built-in text capability if you experience any problems or have any questions. So use that built-in text capability if you need to. Some of you who aren't familiar with the Injury Centre, a bit of background. We're CDC funded, university supported injury control research centre, one of 9 in the nation. Our focus is on injury prevention research, incorporating activities in violence, transportation, safety, prescription drug misuse, substance abuse, suicide, concussion, and we tend to focus on teens and young adults as our primary age bracket. Besides education activities like these, we have distinguished faculty seminars, offer internships, fellowships, symposia, conferences, disseminations, policy support, statistical assistance, and funding for some pilot studies times. We invite you to Tina or check out the website for more information about the centre. Other upcoming events that I would like to mention before we get going too. Next lunchtime seminar is Thursday, May 7th, and Lisa Prosser will talk about cost analysis and injury prevention. And stay tuned for more information about that event and webcasting of that if you can't make it in. I also want to mention 2 other events. Later in the year, we have 2 hot topic summits. One on September 24th on concussion, sports-related concussion, September 24th, and one on prescription drug overdose on December 1st. We're bringing in speakers from around the country for those 2 summits, so please check out the website for more information. They should be really good. Okay, today we're honoured to welcome a special presenter from right here at the School of Public Health, Daniel Eisenberg. He's an Associate Professor in the Department of Health Management and Policy, Director of the PhD Program in Health Services Organisation Policy, PI of the Healthy Minds Network, and Principal Investigator on an Injury Centre pilot study on suicide prevention. And today he's going to share more information about that. So thank you for coming again, and please join me in welcoming Dr. Eisenberg.
All right. Thank you very much for having me here, and hello to everyone out there on the webcast. It's great to see a lot of friendly faces, and I'm excited to present this. This is the first time I think that I've done a formal presentation of this Injury Center project, and as you'll see, I'll talk about kind of how it's coalescing with some other pilot projects into a larger project that also I think this is kind of the first time I've had a chance to formally put it together and present it. And so we've been doing a lot of work related to brief videos and mental health over the last couple of years. But really just the beginning for our research group. And so I'd like for this to be conversational if possible. I encourage your questions and comments throughout my presentation. And also, apparently, if you're on the webcast, you can type in the questions or comments, and Tina will see them and flag me. So please feel free anytime, and I'll make sure to address them as best I can. So what I'm going to do is I'll start off talking about the Injury Center pilot project specifically, but then kind of the second half of my presentation will be about the larger project that has helped us create. So for the pilot study award, the title of the project is kind of long. Innovative online video-based intervention for promoting access to mental health care and reducing suicide risk factors in the college student population. And you can see our study team for that specific project, and kind of for the larger project, there's a much larger team. Blake Wagner, who's over here in the audience, is the creative director who kind of helped create the videos, write the scripts for the videos. Cheryl King, who many of you probably know, suicide prevention expert in psychiatry and psychology here at the university. And she is a clinician scientist who helped advise us on kind of the clinical aspects of the project. Rebecca Lindsay was our study coordinator for really most of the project period, which is now over. And Sonia Doshi, who's a current undergraduate student, has since taken over as our study coordinator for this set of projects. So both of them have been study coordinators. And then Will De Rosario is the film producer. He's out in Los Angeles and does freelance work and has been working with Blake and our team on a number of brief videos. I want to say a little bit about where this project came from, because it is certainly a departure for me and kind of the type of work that I've done. My background is in economics, and so it's been a long kind of winding road to this type of work, but it's really exciting to have a chance to do it. And so back in 2012, way back then, Blake was in Ohio, where he's from, working on the Inkblots project, is what they called it. And he started that with his father, who also was named Blake, and who's a clinical psychologist, and then working with Will De Rosario as the film producer. So it was kind of a three-person team producing brief videos to promote mental health for young people, basically, and to illustrate coping skills, encourage help-seeking behavior. And the whole idea behind the project is that there's all this great information out there about improving one's mental health, but most of it's not very engaging, especially for young people. And at the same time, young people are engaging in all kinds of digital media, especially brief videos. And so if there's some way we can kind of take what makes brief videos entertaining and put the mental health information in that format, then there's potential to make a large impact, large public health impact on mental health and prevent outcomes like suicide. So Blake heard about our college on Depression on College Campuses conference, which we hold annually at the University of Michigan. And he and his father came to that conference, and we learned about his videos. We saw some of his videos. We thought they were pretty good. And Blake was interested in teaming up with researchers to try to understand more about what are the actual effects of these videos and how might they be more effective, and what more can we learn through more of a scientific approach. And so I teamed up with Blake, and at that time I was also kind of growing my Healthy Mind study, which is a web-based mental health survey for college student populations, turning it into what we're now calling the Healthy Minds Network, which is really just means that we're not just trying to do the research, we're trying to disseminate the research as effectively as possible to practitioners, which I know is something that Injury Center is very good at. And so it's kind of a convergence of our interest in having more of a real impact, engaging young people more directly, and this kind of great kernel of a project that Blake had created with his father and Will De Rosario. For the Injury Center project, we had two main goals. One goal was to create 2 new videos. The videos that have been done, most of them, right now I'd say there's about 15 total videos. It's kind of this set of projects, but not many of them focus specifically on higher risk populations and really on kind of people with significant risk factors for suicide. And so we wanted to create videos specifically for that kind of, for that need, for people who are experiencing significant depression, suicidal ideation, heavy alcohol use, other kind of major risk factors. So we wanted to create 2 new videos, and then to start testing the effects just through a feasibility. As a pilot study, we tried not to get too ambitious. We said, okay, let's just test the feasibility of delivering these as an intervention. We're not going to do a full-blown randomized trial just through this pilot study. And so a lot of work went into these 2 videos, but to condense it into one slide, essentially what we did is Blake and especially Rebecca Lindsay met with a lot of students, conducted a lot of focus groups with this diverse set of students as we could reach. We tried to, and we did reach many different student groups, such as students in the International Center, Greek life, student government, and so on, and met with students individually and in small groups for a period of several months, just to try to get a better sense of. We showed a lot of our Blake's previous videos and said, well, what resonates, what doesn't resonate, what would be kind of most relatable to you and people you know, and what would be most helpful, and then Blake largely wrote the scripts, and then Wilda Rosario worked with Blake to produce these 2 videos. So Dory is how you pronounce it. I don't know where you got that name. I still don't know, Blake. I've never seen it anywhere else. I think Blake just made it up. But Dory and 4 words. And so I'm not going to show you any videos today, but I will tell you where you can find them if you want to watch them. So if you just search Tinyshifts on YouTube, then I think it's the Tinyshifts channel on YouTube where you'll find these and some of the other videos that have been created. But just to give you a quick recap of what these videos are about, Dory is, the idea was to kind of create a highly relatable story about a female college student who experiences some problems that are fairly common. Heavy alcohol use, depression, the combination of the 2, feeling like she can't really share her problems with her peers, but then ultimately seeking help successfully and showing kind of some hope at the end. So it's a fairly kind of common story that we tried to portray, but we tried to do it in a really interesting way. So you can take a look at the video and judge for yourself. But we were pretty happy with the result, and we got mostly positive feedback from students for this video. The second video is the idea was sort of a companion video with the same character, the same Dory character. By the way, Dory, this woman here, her name is Daisy Bishop, and I don't know if she's probably just about to graduate. She's a theater student at year round that Blake and Will found, and extremely talented in my non-professional opinion. So in the 4 words video, the idea was to illustrate a little bit more about what depression looks like and feels like for a young person, and so it opens with some shots and some scenes of the children, of kind of the things that make people happy and inspired in life, and how that can be stripped away when people experience depression. And then it ends with a message of the importance of reaching out to your peers, and the power. The 4 words in this case are I'm here for you, and the fact that a friend in the video said those words, and the Dory character felt like it turned things around for her. So part of the goal with these videos is to kind of directly encourage help-seeking behavior and demystify that process a little bit and normalize it a little bit, but also to encourage young people to reach out to their peers, which, as you might know, is sort of it's an increasingly popular approach in college populations and in high school populations, the idea of gatekeeper training, that we can all be gatekeepers for each other and identify problems, reach out, and refer to appropriate resources. Any questions, comments?
How long are the videos?
How long? Dory is around 4 minutes, and 4 words is about 2 minutes. We're still trying to kind of playing around with different lengths, and often we do get feedback that 4 minutes is way too long. And I think our conclusion so far is that it really depends. Probably the videos that initially kind of hook people in to our interventions should be short, maybe only a minute or 2. But then maybe once people are engaged, they'd be willing to watch longer videos, more in the 4-minute range. 4 minutes is sort of the YouTube length video, but obviously there isn't just one standard.
Is that kind of also why you decided to go with a companion series rather than kind of a male character and a female character?
Well, that's, I mean, the big question really for us is we have these kind of this collection of mostly just kind of independent videos. This is one case where they're a pair, but I'll show you some of our initial evidence, but we're doubtful that watching one video is really going to make a major impact on many people's lives. But we think somehow some collection of videos, some package, or maybe using the videos as a kind of a gateway to other more intensive interventions or resources. So the question really is, how do you kind of package them together? So far, it's kind of a loose collection of independent videos, but we think one thing that we hope to do in the coming years is to develop kind of a series where there is a character that people can follow. And ideally, there would be multiple series, so it's not just, because some characters are going to resonate more with others, with some people, and some characters resonate with other people. The problem, of course, is that it takes a lot of videos to kind of achieve our vision. And right now, our capacity is pretty small, and we don't have a lot of funding. But that's kind of the dream, is to have like this full library of, and some with characters that people follow, some that are kind of more isolated videos. Okay, so we started out testing. At first we kind of had this. We took it for granted that people were going to watch the videos, because almost everyone seemed to like the videos when we showed them to focus groups and showed them in presentations. So we thought, okay, when we're doing our research, we want to do kind of pre-post assessments of outcomes and working towards a randomized trial. It would be people are obviously going to watch the video if they go online. But actually, it turned out at first in our initial feasibility testing, where we had people do something like a 5-minute baseline survey online. So first of all, we email people, we invite them to a research study, and we say, we're trying to develop new ways to help college students cope with stress more effectively. And we'll invite you to complete a brief survey and then participate in our program or intervention. And so people would do a 5-minute survey. Then after that, most people didn't even go on to watch the video that was linked at the end. And so we had to take a step back and realize, okay, this is the population that we're dealing with right here. And many of us probably who are older are kind of increasingly that way as well. Like we have a lot of things that engage our attention on our smartphones and our computers, and a research study, even if it's an interesting video, is kind of a hard time competing. So we finally figured out a way to actually watch the video after our baseline assessment. So one thing we did is we made the baseline assessment really short. We just made it 5 questions or so, 4 questions. So it wouldn't kind of tap into the limited attention span. And the second thing we did was, when we described participating in the study, we said to start off, there's 3 steps. Step 1 is you're going to take a very brief survey. Step 2 is you're going to watch a brief video or read an article, because that's our control conditions, an article on basically the same topic, an online article from a reputable source on the same topic. And then step 3 is you'll give us your very brief feedback afterwards. And we think that giving people something to do after the video actually induces them to watch the whole video, and basically it worked. Once we did it that way, we got over 90% of people who did the baseline survey, started the baseline survey, to actually go through and watch the video and provide a little bit of brief feedback, just kind of, did you like it? Do you think it was useful? So I think college students are, it sort of reminds me of like kind of basic things about teaching classes. Like college students are pretty good about following clear instructions, and so if you frame it in that way, obviously a little bit artificial, but we needed people to actually get exposed to the intervention to actually be able to test the effects. So we feel like we have a pretty good formula for starting to test the videos and their effectiveness. And so we've since kind of built on that to conduct 2 randomized trials so far. And so first of all, last summer, we, as I said, we got over 90% to view the videos. And of those, over 80% actually viewed it to completion because we put the videos on a site called Wistia that posts videos and tracks the analytics, basically the viewing statistics, so we could see what percent of the video people actually went through with. And it was over 80% went to completion. But we found basically very little evidence for any positive effects of watching one of our videos in that. And we assessed outcomes in that case. I think it was 4 weeks later. It's either 2 or 4 weeks later, we did a follow-up survey and gave people incentives at that point. So we got a pretty good response rate on the order of 70% response rate or 80% response rate at that later point for people who participated at baseline. But there was no apparent effect on our key outcomes, the use of coping skills, actually mental health symptoms, and use of mental health services or intentions to use mental health services. So it wasn't too surprising. It's just one video, a 3 or 4 minute video. We weren't expecting to change people's lives dramatically, but we wanted to give it a shot with just one video. We did a second randomized trial in a related project called Athletes Connected, which is specifically for, in a little bit, I'll talk about kind of how these related projects, how they're kind of all fitting together. But just for now, it's a related project focused on the student athlete population, where seeking help is especially difficult, it seems, in terms of the data that we have and just talking to people, not wanting to reveal weakness to teammates and coaches, and concerns about what would happen if I see a therapist. What would that mean for my status on the team? And so we did a randomized trial for videos targeted to student athletes. Again, got really high viewing rates for people who could participate in the study. And then we actually found some positive effects, which is really exciting. What we found is, first of all, comparing a video, this was a 2-minute video, to an article. The articles were from NPR and Psychology Today. So professional articles on the same topics. And the topics were deep breathing as a coping skill, and basically a cognitive technique to kind of restructure negative thoughts. Basically, the video was saying, imagine what your best friend would say when you're having negative thoughts, kind of reframe them in a more positive way. Cognitive restructuring. And so for those coping skills, we found, at least for the deep breathing video compared to the article, there's a clear, more than a doubling in the actual reported use of the coping skill 5 weeks later when we followed up with people. And related to that, as you might expect, there's a much greater likelihood that people reported remembering the video as compared to the article. And that's the whole idea. So we think videos are just more engaging, more memorable than articles. It's not that they necessarily convey different content. The articles were good, and actually the feedback that people gave at the articles, almost everyone said, these are really good articles, they're helpful, but then they didn't remember them. So we have some evidence, at least, that these things can help. Although we did measure mental health symptoms, and we didn't see any impact there, so it didn't translate into a mental health improvement, which would have been kind of miraculous, I think, if it had. But at least we're kind of on the right track. That's what we feel like this is saying. So our next step in terms of the research evidence is, and this kind of comes back to our injury center project, and the focus is to do a large randomized trial with college students, and we're hoping to launch it actually next week. It's kind of not ideal timing, the end of the semester, but otherwise we have to wait till the fall. We really want to get some evidence now because we're hoping to use it for an NIH proposal in the fall. So we want to get what we can right now. And so we're going to focus on students with co-occurring depressive symptoms and heavy alcohol use, 2 of the main risk factors for suicide. And we'll be using two videos as our main intervention. One is the Dory video that I mentioned that came out of the Injury Center project. And the second video, Choose One Thing, is actually came out of a film competition that we held last fall. We invited college students nationwide to create their own video in the same kind of spirit. We left it very open about what, basically, a video about mental health or coping with stress or challenges significant challenges that you might have faced or that someone you know might have faced. And we got a lot of great entries by students. That was our hope, is that, kind of unleash the creativity of young people to see what they come up with instead of just deciding for ourselves. And one of the best one of my favorite ones was by a student from Emory University called Choose One Thing. And you can find it also on the Tinyshifts YouTube site. A 2-minute video. We limited it to 2 minutes in this case. And this video was just basically about the idea, the theme of it was just when you're struggling, choose one thing that makes you feel better. Basically it's one coping skill. And then it sort of illustrates that it kind of goes through several different coping skills, several different people doing things that are considered healthy coping skills, like relaxing and reading in the sun in a hammock. or they showed deep breathing, they showed yoga, or I don't know if that was yoga or stretching. And so what we're going to do in this trial is a 2x2 factorial design where we're going to randomize people. First of all, we're going to randomize people to either the video condition or the article condition. And within the video condition, they're going to get each combination of the two videos. So some people will get, hopefully there aren't any students who are going to be invited into the trial who are listening now, but it's okay. Probably not many. I don't know how that would have influenced the results if you know everything about the study ahead of time. So some people will get the Dory video first, kind of the video about help seeking, and then a week later will be given the coping skill video. Others will have the reverse order. Others will get the Dory video twice, because we think that these videos are good enough that people might actually be willing to watch them twice. And now that I've watched them dozens of times just in the course of kind of our research, I feel like each time I get something a little bit more out of it. And it's possible that maybe one video can have an impact if people watch it multiple times, or maybe it matters when you watch it and sort of whether you're receptive at that time. And so if you try multiple times, kind of along the lines of, I've heard Ken Resnick talk about epiphanies and sort of how behaviors, there's a lot of kind of randomness as to when people are receptive to health behavior change. And so if you try different times, then maybe you kind of hit on that epiphany. And the outcomes are going to be help seeking, use of services, although within our compressed time frame of like 3-week study, probably unlikely that people are going to actually, even if they decide to get an appointment, they actually get an appointment. But intentions to seek help, attitudes about seeking help, risky alcohol use, that's a behavior that could change quickly in theory. Depressive symptoms and use of coping skills. Any questions about this so far?
I have a question. Given that one of the outcomes you're hoping for is that they'll actually seek help, it seems like you might end up with a good portion of your sample that isn't really in a situation where they need professional help, but these skills are enough to kind of wondering if really you want. It seems like almost have you thought about maybe or screening participants they fall high enough in terms of symptoms that they might respond.
Yeah. Well, so in this trial, the way we're setting the bar, the eligibility criteria are going to be a PHQ 9 score of 10 or higher, which is considered moderately severe and higher depressive symptoms. Not everyone above that cutoff would receive a clinical diagnosis if kind of examined further, but the large majority would, based on the validity testing of that screen. The alcohol, I think, is where there's going to be more question because we're using the audit, and I believe our cutoff is going to be 8. And I know a very large number of college students meet that threshold, and probably a large portion of those people above the threshold would not then meet criteria for abuse and dependence if kind of probe further. So I think, I mean, that's what what we're doing is just acknowledging that there are multiple relevant outcomes and measuring each of them, help seeking, use of coping skills. But you're right that it's not, help seeking is not probably the clearly best outcome for everyone, even in this higher risk sample that we're focusing on. But what we can also do is it's not going to be a huge trial, but it'll be large. We'll have 150 in video condition, 150 in the article condition. But yet large enough to at least do some subgroup analysis where we can focus on even higher thresholds, where probably help seeking is the appropriate next step. Yeah.
We were kind of talking about the epiphanies and different timings. How do you send the different videos at different times, or do you send how do they vary that time?
You mean the time of day?
Yeah, so they're getting 2 videos. And
yeah.
You need to repeat the question. Tina's saying 2.
Yeah. Oh, yeah. So the question is, well, how are we setting the time at which time of day for the videos? I mean, for this particular trial, I think we're not really. Although I did mention that as something that's worth varying, we're not going to be explicitly varying that. I think we'll probably just use the same time of day, some around midday or late afternoon, when we think people are more likely to participate in the study.
Did the data analytics capture that when they watch the video?
Yeah, we can know that, and that, of course, that probably depends mostly just on when they check their email. But but I think in the future, and I'll talk a little bit more about kind of our future research, and there's lots of opportunities for kind of more sophisticated randomized trials where and one my key collaborator in this domain is Inbal Nahum-Shani is her name. She goes by Billy. I don't know if anyone knows her. She's an ISR, but she's with Susan Murphy's group in the quantitative methodology program, where they've been doing a lot of what are called SMART trials. Probably many have heard of those: sequential, multiple assignment, multiple random assignment trials, and also where trials where they vary things like time of day, or they call them micro randomizations. Like the same individual, we kind of provide you the intervention in many different forms over a sequence. So we are going to be playing around with that, but not so much in this trial. Okay, so now I'm going to talk about kind of how the Injury Center project has coalesced with some other projects into this larger project. And this larger project is, I would say, it's not just a research project anymore. Now it's kind of becoming both a research project and kind of an impact project. And we're hoping, and consistent with what I said about our research practice network, we're hoping not just to advance knowledge, but to have an impact as we go. And so I'll explain more about that. But so we have the Injury Center project focused on higher risk students. The Depression Center awarded us a pilot funds around the same time for kind of a more general population approach to brief videos. The university's, the Provost Office and the Third Century Initiative, we received a grant to, this kind of help us move towards not just research, but impact. The Global Challenges for the Third Century program, which some of you might be familiar with. The idea there is through science to achieve impact. And so that kind of helped move us more in this direction of taking the research to having a global impact ultimately. Blue Cross Blue Shield of Michigan Foundation has funded us to do to kind of apply this approach to employee populations, and so we're preparing for a randomized trial with University of Michigan employees to test a couple of employee-targeted videos with some older actors and the kind of themes more related to workplace stress. And then the NCAA that funded us for this Athletes Connected project that I mentioned. So it's all kind of coming together, we hope, to this project, which we're calling Tinyshifts. And I think Blake came up with this name of Tinyshifts. So I don't know if you want to trademark it or not, but we can always stick that in. And the idea is to harness digital media to promote mental health in youth populations. And so we're expanding it from videos to digital media because although videos will remain the core, we're thinking about videos are not in isolation. People do not find videos in isolation. They're not just like floating out there to grab. They are part of a larger digital media world, and whether it's apps or websites, social media. And so we want to start thinking more about how to fit things together in a way that reaches people. Okay, so this is all in some ways kind of backing up to say more about the motivation for this larger project. And so first of all, we would argue that mental health is the most significant health issue for young people, or at least one of the top three. So first of all, the Global Burden of Disease Project by the WHO and the World Bank, where they quantified the contribution to burden of disease for different conditions, for different age groups in different parts of the world, has found that psychiatric and mental conditions account for by far the largest portion of burden of disease for people ages 15 to 24 in the US and other higher income countries. And that's going to be increasingly the case, I think, in lower income countries as infectious disease and issues like sanitation, malnutrition recede. Mental health, as far as we can see, mental health is not an issue that kind of recedes as countries develop politically and economically. In the US, the prevalence of mental health conditions is really not that different in countries with very low income. There's also this concern that mental health pathology, depression, anxiety are increasing among young people in the US and possibly other countries. The evidence there, I mean, it's hard to really say for sure because mental health is inherently self-report. So it might just be that people reporting differently over time, maybe as attitudes change. But there's this interesting study by Jean Twenge and colleagues where they went back to the 1930s and all the way up to the present, and they looked at the Minnesota Multiphasic Personality Inventory, the MMPI, which has some short scales for depression and some other mental health issues. And so there's an example of a scale that's been consistent, it's been fielded for generations for all kinds of populations. Now, there isn't any national sample that's done every year, but there's lots of studies that they kind of piece together, and they did this huge meta-analysis and basically plotted out the results. And depression, for example, just has kind of ticked up incrementally, almost basically linearly since the 30s for young people, for adolescents and for college populations specifically as well. And so even if it's true that mental health is, and I think you probably have heard that in college populations, there's been a very clear increase in the use of mental health services, and counseling center directors have reported almost unanimously that they're seeing higher numbers of students with significant mental health problems coming into their centers. And so there's this sense that these issues are on the rise. And one of the possible explanations that Twenge and her colleagues talk about is a shift also in the MMPI, that they can document this shift from more kind of intrinsic motivations to extrinsic motivations, like being popular, being kind of famous, recognized as successful, having more money. These kinds of things appear to be more important to young people today than they used to be. And in these things also, there's all kinds of research, which many of you probably know about, that show that extrinsic motivations are less likely to make people happy than intrinsic motivations. Like one's own kind of morals and values, and kind of doing things for their inherent pleasure. And there's plenty of reason to think that social media or digital media might be exacerbating this trend. If it's a real trend, if you think about Facebook and how people use it, and you probably have seen some of the research out of Michigan showing that Facebook use can predict increased depressive symptoms. That could be part of the issue. So what we do, we also, as I was saying, we know that digital media has significant influence on young people's lives. They use it constantly, and there's lots of evidence linking it to well-being in different ways. Mostly negative, but some positive. Blake led our effort to write a kind of a review study about this topic of social media and mental health. So if you wanted to read more about that, we can forward you that article. But we see this as an opportunity. We see this, so digital media is clearly important for young people and their well-being. Is there some way to kind of harness it in a positive way for mental health? We're not the first ones to come up with that idea, and there's hundreds of apps out there and websites that you can find that have the same kind of idea. But we think maybe we have a slightly different way about thinking about it. And so we think that a kind of an ideal solution, so to speak, would have these characteristics. First of all, coordination. Rather than having kind of thousands of apps that people kind of would find almost haphazardly, there's some way to kind of provide a clearinghouse or provide some kind of vetting process so that the more effective, kind of more scientifically based, more engaging things kind of rise to the top, or presented in a way that people kind of make sense of rather than kind of picking just based on more idiosyncratic factors. That could be important. The scientific rigor is very highly variable for a lot of these digital media products and videos, and so somehow tying it more to what we know about what promotes mental health is important from a scientific standpoint. And this is inevitably going to require a large amount of interdisciplinary collaboration. And you can already start to see that this is, in many ways, Michigan, this university is well suited, I think, for this kind of effort that we're talking about. And then the fourth and maybe most important thing is that any kind of systematic effort needs to engage young people themselves. So I'll just talk a bit about how we're trying to implement each of these different prongs of our approach. Okay, so this is kind of reiterating, just saying basically our approach is to try to address each of these four issues that we feel like are needed. So first of all, in terms of a coordinated approach to digital media, so what we have so far are the brief videos, and one way of tying them together is through a mobile app. We understand that there's so many apps out there that ours might just be the millionth one to just end up on the shelf and not use, but we want to give it a shot. If nothing else, it'll be a way to help us organize kind of how they fit together. And so we almost have, we're almost ready to have a prototype that we can test internally. And then if any of you want to help us test, let us know. We can put it on your, only available on iOS for Apple. So if you have an iPhone, then you'll be in luck if you want to test it. But we will create an Android version. And so John Hinckley, I couldn't find a picture of him, but he rides motorcycles apparently. So he's in electrical engineering and computer science with Professor Jasprit Singh, and they've been helping us create this app. They've been doing the technical side of it. And Jasprit has, we found him because he's actually been creating a somewhat similar spirit of a platform called the Mentor, which is sort of like an app. It's more than an app, but delivers content like language lessons and yoga kind of videos throughout people's daily. It tries to kind of integrate with your daily life. But I mean, you can look it up, or I can tell you more if you want. The other, well, let me just go on because I know we don't have a ton of time. But that's kind of where we're at so far. Yeah. Well, the other things that we're hoping to do is, and we have some UROP students, the Undergraduate Research Opportunity Program. We have 3 of them who are, and they're going to continue next year, helping us with our effort to start curating resources. That curating is a term that you might have heard in the context of digital media, where it's taking stuff that's sort of like the museum does, taking good stuff and kind of making sense of it, vetting it, putting it together. And so that's something we want to. We think maybe this is. I mean, this me and envision. Who knows? Like which of these pieces actually pan out? But I think again, Michigan is an ideal place to do this kind of curating effort because you have the experts in all the relevant areas. You have the large number of talented and energetic students who could help. And so we want to at least try to start that process. So this is just kind of some screenshots for some of the other videos, as well as the Dory video again, and choose one thing. There's Blake is an actor, as well as other talents. And then this is I guess what's called a wireframe for the app that we're going to be testing soon. One of the screenshots. Okay, so there's Billy from my co-PI from ISR, and she's really kind of her expertise is on the research and evaluation side, the kind of the fancy randomized trials we hope to do. So I don't know, I probably won't say anything more about that right now, except that all of this, of course, needs to tie into science, both in terms of the motivation, the coping skills that we actually want to put in there. There needs to be some basis to believe that they can promote mental health or change health behavior, and then actually to test the effects. We want to do it rigorously, not just to see if people like it, that it's going to make a difference in people's lives. Now I just want to give a little bit more sense of the potential. We already have, I think, a nice multidisciplinary collaboration, but the potential is even larger. And so, you know, we're working through the Injury Center, through this pilot project, and then there's myself and other people in public health, the Depression Center, ISR. We're working with a professor in screen arts and cultures who teaches film production to students. I actually went to his class. His name is Victor Fanucchi. He went to his class a week or 2 ago, and because he was just giving an assignment to students to create a film, and we said, and since he's working with our teams, he let us come in and say, hey, we're doing this Tinyshifts project. This is what it's about, and we hope maybe one of your teams might want to do something along these lines, and then we would be happy to kind of help work with you and promote your work without restricting the artistic kind of creativity. So we want to engage students in screen arts and in engineering. I already mentioned psychology, business, information, athletics. Alumni Association has some interest in what we're doing, and maybe kind of reaching alumni through some of the videos, or maybe creating through the lifelong learning program a module on mental health and coping skills based on the videos. And then there's external partnerships that can help us to achieve impact on a wider scale as we grow. So Active Minds is a national advocacy organization run by students all over the country, student mental health. Our Helping Minds Network, the National Network of Depression Centers. We have Michelle Reba has been prominent, and she's in psychiatry. She's been prominent in the World Psychiatric Association, and so there's these world networks which eventually we might be able to tap into. And also, we think it's important to involve health technology companies, because as academics, I don't think we're in the best position to do some of the things that we hope will happen. We're not nimble enough. We can't scale up as quickly as private companies sometimes can. So I think for some things, for some of our ideas, we hope that we'll work with health technology companies to so that they can really implement it more effectively than we ever could. And then the bedrock of what we're doing again is, I think, youth engagement, engaging young people, and this is sort of in the spirit of community-based participatory research, which has been promoted, as many of you know, in this school here by Barbara Israel and many others, especially in HBAT. But in that same spirit, we want to involve the actual populations that we're trying to influence in the creative process and in the research process. And so one notable way that we're doing that, this is again Sonia, our study coordinator. She is leading our student leader coalition, what we call it, where it's mostly undergraduates, but some graduate students have been involved, where and they've been meeting once every couple weeks since last summer. And a lot of the students involved are leaders from other student organizations, like Student Government, or Greek Life, or the International Center Student Advisory Board, or there's organizations from engineering. There's many others, and they've been kind of helping inform our research and like looking at our videos, giving us feedback. But also they've been putting on events of their own. And actually last night, I don't know if any of you saw at least the advertising about the mental health monologues that took place. But it was just amazing. They had 9 different students perform for a few minutes each monologues about their own experiences with mental health. And it was powerful. They also Sonia and this coalition helped organize and promote the film competition I mentioned last fall. Maybe there's just a couple more slides, but let me since I just have a couple more minutes, maybe just go to the end and then see if there are any last questions or comments. So our ultimate goal with this is grandiose, but we want to, we're leaders in the best, so we want to dream big. And so what we think of our metric of success for all of this is how many young people can we reach with something that's empirically based, that we have some reason to think actually benefits people. And we're setting our targets high because, as you know, one video goes viral, then suddenly you're reaching millions of people. So we're hoping we might be able to reach more than 1 million young people within a couple of years, and if so, it would be done at a very cost-effective rate because we're not planning to spend more than $1 million per year in that time frame. And so if you can reach 1 million, then you're doing it less than $1 per person, or less than $1 per person. So let me see if there are any other questions or comments. Okay, so well, we welcome if anyone's interested and wants to follow up with us, we're always looking to kind of form partnerships or bring new people in, whether you're a student or a staff member, a researcher, faculty member, community member, and so on. So we hope to hear from some.
And can I just say before everyone runs off, Tina has some evaluation forms too that she'll hand out. You can complete those. And thank you again.